Well, thank you everybody for being here. My name is Dewey Case, CMAC Technical Director. This is our next installment of our webinar series sponsored by Solenis. We're very happy to have Marty Mulgrew with HydroApps here. Just as a side note, my county facilities have just onboarded HydroApps. We're really happy with it. Really good program, really good app suite. So, Marty, many thanks to you and the team on putting together really a good product for aquatics. So there's my unsolicited plug, for HydroApps, right? So it's springtime. Spring has sprung. Katie bar the door. So without a further ado, I'm going to turn it over to Marty, and then once Marty gets through with his presentation, we'll open up for Q&A. Just as a reminder, this is being recorded, and this will be posted to the CMAC YouTube channel within the next week or so, right? So look for that, right? So Marty, all yours, my friend.
All right. I'm going to go ahead and share my screen for everybody. We can get the presentation up and running. So I'll get that started here. Oh, I wanted it in presenter mode. Here we go. All right. Well, thank you guys for jumping in and joining us for effective aquatics facility documentation. And Dewey, thanks for the plug to HydroApps. We really appreciate it. And I mean, that's what we're here for, is to make operations more efficient, make your life easier as operators. And that's what we're going to be talking about, right? Is how do we take our documentation, transform, going from compliance into operational intelligence, making better decisions off of our data here. So I'll do a quick intro here to myself, just so you guys kind of know who I am, what I'm about. So I spent about 15 years in aquatics and recreation, and then I've spent the last 2 years working in HydroApps. So I've been around the aquatic space for over 17 years now. My last stop as an aquatics facility operator had 14 pools and 6 splash pads, and 300 plus guards and swim instructors and swim coaches and everything like that. So I know how this feels. I understand the what the springtime looks like, and what summer preparation, what year-round facility operations look like. So happy to be here, talking aquatics with you guys today. I'm a husband, father to 2 little ones, and I'm a proud Aggie, so graduate of Texas A&M University. So big whoop out there to any Aggies. I love anything in the outdoors, the Astros baseball and college football. I did get to go to an Astros game this last Saturday. They lost their first 2 games, and they've won all of them since the one I went to. So I feel like I was good luck for them there. And then if you ever see me out in public, you will likely catch me with a Diet Dr. Pepper. I'm a firm believer that it is the elixir of life. So unless I am in somewhere in the country that it does not have Dr. Pepper readily available, and then Mr. Pibb or another option is not acceptable. It's got to be the real deal. All right, so why does this topic matter today? What is this about? So is your documentation just helping you run your facility, or is it just keeping you compliant, right? Most facilities, you guys are collecting, your data daily, but not everybody is using it effectively. So your documentation, the data that's included there, that's a huge untapped operational asset. So it really matters. It makes a huge difference on how you're using the data that you're collecting in your facility, versus just, checking a box off to make sure that you're compliant with your local codes. So agenda today, what we're going to walk through is understanding your documentation lifecycle, identifying some gaps, talk about how we can turn that data, analyze it, turn it into insights. We'll go through some real world examples using some aggregate data from the HydroApps aggregate data, and how we can bring some insights out of that. And then we'll talk through how to build that framework and implement it for your operations going into this season. So let's talk about the problem today. A lot of folks are just doing checkbox compliance, right? It is treated just to make sure that, hey, we know that we have to do it, so we're gonna document the data, but we're not doing anything with it. Do we have inconsistent data, right? Inconsistent across staff, inconsistent across shifts? Do you have different language on your forms at different facilities? Is everywhere using information correctly the same way? Or do you have different testing times? Looking at inconsistent data is going to, provide a lot of gaps in your operations. A lot of places don't review. They don't have a really good review process in place. This data, especially if you have multiple facilities, creates an opportunity for you to make better decisions in real time, not just at the end of the season going through your information for next year, but making your operations better day by day by analyzing the data that you're going through. And then some of the additional issues that we see today is just limited visibility, right? If all of your chemical test paperwork's in the pump room or at a desk, and you've got an office separate somewhere else, you can't make decisions off of that for your operations. And yes, your staff, you're training them to make decisions and help with that, but it's important that you have visibility as a supervisor, as an aquatics facility operator, to make better decisions off of that data. So let's talk compliance versus operations, right? Compliance is, did we do it, right? We've got to meet that requirement for the state. Versus operations, what does it tell us? How does it inform what we're doing? We need to shift that mindset and go from record keeping to decision making in our operations, using our documentation, using our data. Touching base on the documentation lifecycle. So as we go through this, we're looking at capture. Obviously, that's where you're going to be collecting your information, validating, right? Is it complete? Do you have, all your testing times, or all the, pieces of the puzzle filled out, right? Like, is every form, fully filled out? Where are you storing your data? How are you storing your data? If you're doing it on paper, how do you get back to you? How do you go through it? Are you just storing it in boxes? If you're storing it digitally, where is it going? And then the review process, right? Who is looking at it? When are they looking at it? How often are they looking at it? Who's in charge of owning that? Analyzing the data, understanding your documentation, what's going through it, what information is coming out of it, and then acting on it, right? You've got to take action. Do you need to update your operations? Do you need to update your documentation? Making decisions off of that documentation, and then doing that, right? Doing that at least once a year, if not more frequently. And depending on which piece of documentation you're looking at and going through this life cycle, this is something that maybe is done, weekly, monthly, but at least once a year, looking at your documentation and understanding what it's doing for you and what information it's providing and how it's influencing your operations. So let's talk capture. So this is the on-deck execution, right? This is what your team is doing. Ultimately, you're getting your documentation, you're putting it in their hands, in your team's hands. Why does this matter? What matters here? Making it simple for your staff, making sure that it is easy for them to fill out, that you've got standardized inputs, right? That you're tracking the same information, that if you write CL to track chlorine on one pool chemistry documentation tool, that you're doing that across all the others. You're not writing chlorine or something different, right? It's understanding that the easier you make it, the more standardized you make it, the easier it is for your team to collect this information. And then what matters, right? Getting the right data at the right time, right? Like making sure that, your pool test data is accurate, that the time that it's taken matches where it's being documented. So if you've got a log that says it was at 9 a.m., it should be at 9 a.m., right? Plus or minus a few minutes. That way that your data is accurate. It's coming through at the right time. Right, we've got the water chemistry logs, your incident reports, right? Knowing that it's easy to fill out, it's simple for your staff. You're collecting the same information every time, so you can compare and identify trends, right? And that you've got the right data. This is the right incident report. This is when it happened. This is where it happened. Your in-service training documentation, who attended, right? You're tracking what you guys covered, who attended, what you guys talked about, what drills, what equipment you use. All of those things matter as you're capturing your data. And going through the system, going through your documentation here. Looking at validation. So this is your data integrity. What matters here, right? Are entries complete? Are the values reasonable? Does it make sense of what you're tracking? Are your timestamps accurate? So we touched base on that a little bit already. But looking at things like, when you validate your data, are you missing tests, right? Like, do you have pool tests that haven't been filled out? Are you having out of range values flagged, right? Do you have a way on your tools, on your documentation tools, to let you know as a supervisor when an incident occurs, when a water chemistry test is out of range? Are you backfilling logs? Are you having to go through and fill that out? Where did that information come from? When was it collected? How did it get filled out? Are you just guessing? Are you taking, hey, we had a pool test here at 9 a.m. and we had another one at 1 p.m. We were supposed to do at least one or two more in between then. Are you guessing, or did you actually do it? Where did you get that? As a disremembering? So understanding, and validating, those backlogs, validating your data as a whole is really important. So making sure and setting up your documentation, your systems to have validation built in to when that data is being collected and how it's being collected. Storage. Where are you storing your data, right? Centralized storage is going to be really key. Best practices here are having a single source of truth. So understanding, where it's getting collected, do you have, is all of your paper documentation getting, stored at the facility and then getting brought back to an office, a main office somewhere? Is that getting input into certain spreadsheets? Is it the same spreadsheet, every time for each of those pieces of documentation? Who's in charge of owning that? That single source of truth is going to be really, really important, right? As you report out your information, as you identify trends, as you make decisions off of that, as you report up to your stakeholders, all of that information is going to matter. Having that single source of truth is a huge best practice in your documentation, making it really easy to find and utilize. And again, then making it accessible across the roles, right? This is important information that needs to get tracked, it needs to be organized, and people need to be able to find it and help make decisions off of that. So, right, is that accessible to your stakeholders, your supervisors, your directors, division directors, department directors, whoever that might be? Is there supervisors underneath you, your facility staff that needs access to certain pieces of that information so that they can understand what's happening in those facilities? So the storage and how you're doing that, how you're utilizing that, and setting that up matters to make that difference for for your organization. And then making sure your data is organized, right, by facility, by asset, by date, that you've got a clear way to know, across all of your facilities, whether it's one or many, that you're tracking the same thing across each of these. They're set up the same way. Again, the more uniform, more standardized you make your documentation, your storage process, the better data that you get out. And when you don't do that, you run the risk of losing data, information, not getting entered into a spreadsheet or something off of a paper form, or just being stored in paper and not being looked at. Eventually that data gets destroyed, for record retentions, and you don't have a way to utilize that and make decisions off of that. You got, issues where you don't have the ability to identify trends. Those aren't visible for you. If you're not, utilizing those best practices on data storage. And then you've got audit challenges, right? Where it's when you're auditing your data and you're going through and trying to understand that and make sure that it's been filled out correctly, or if you have a public records request, right, of the challenges of where that information is stored, and how it's getting stored, how you're able to pull that up and report on that. All of those things matter when you're not going through storage requirements and going through best practices for your storage requirements. So let's talk about the review step, right? This is that supervisory layer. I think that we need to make a critical shift in our operations and how we think about this. Documentation's got to be reviewed regularly. I'm a huge proponent of this, where you're constantly reviewing this and you're making your decisions in real time. And if you've got a ton of facilities, when you make those reviews, don't do it at the end of the season. Do it in real time, right? Daily review of chemistry logs, weekly audit of your incidents, understand, year to year, week to week, what's happening in your facilities, looking at a monthly trend review, right? Setting up these reports, setting them up ahead of time so it makes it easier for you to identify them in season, is going to make your life so much easier and help improve your operations, not for next season, but for this season, right now, and make your team better than they were. And they will have those insights as well as you share them with them as you review those. And then I want to talk just to some of the common gaps here again is the data gets collected, but it doesn't get looked at. So make sure that you guys are looking at this. And I know that, again, I'm going to hammer this point home throughout this entire presentation, because, again, it's that untapped resource that makes your operations better. So as you're reviewing this information, make sure that you are constantly, or as you're identifying your documentation, make sure that you're reviewing it, that as it comes in, that you're doing something with it and not just letting it sit to get looked at in the fall, and help inform for your next summer season. Use it in real time. So let's talk analysis, and taking your data and turning it into insights. So what are some things to look for here? So identify trends, right? Look at, are we testing often enough? When are tests being missed, right? Discussing through those missed tests, missed incident reports, looking at your incident patterns. What sort of incidents are the most common? What training topics are actually getting used during your in-service training, when and where your rescues occurring. So discussing all of those things matter. And that helps you start to benchmark, right? Like you can look at what industry standards are through the MAHC, right? And understanding what those are, and are you meeting those, are your in-services covering everything that needs to get covered, right? Are you hitting those topics that need to get covered? And as more and more data gets available from these sorts of documentation, reports that are coming out, kind of these state of the industry reports, the better you're able to benchmark what you're doing against other facilities. And I think that's really important. I think that's a huge shift in the industry. Is the more we collect, the better data we collect, the better we're able to share, the better we're able to put together benchmarking, reports for the industry as a whole. Right, we do a great job of reporting on what our lifeguards are getting paid, right? And we do a lot of salary benchmarking on those sorts of things. And does that matter? Absolutely. But we don't do a great job of benchmarking this sort of data against other facilities across the country or even within our states, of how do we compare against what the standards should be and what's actually happening in the industry as a whole. And then we're on to action, right? Where we've got to make the operational change, right? And this is where that value is realized of your data. Some examples there are adjusting staffing patterns, right? Like if you've got a lot of rescues occurring, is that related to a certain time of day? Are they always occurring at a certain time of day? Is that related to glare? Is that just a program issue? Do you need more staff up because of that? When you're looking at, potentially modifying your training focus, what sort of incidents are you actually seeing come through? Which zones are they at? Are you practicing those skills in the zones that your rescues are occurring mostly, or are you doing it in the deep end because that's where it's easiest? But that's not where most of your rescues are occurring based on your data, right? Looking at improving your testing schedules, where if we see a big dip, but we're taking a 2-hour gap between our testing, and we don't know how soon it's dipping, right? We don't know exactly when we're seeing a change, right? So if you're going to, modify your testing schedule to increase the amount of data that you're collecting to understand that better, taking that action is going to be based off the data to help you understand what's happening in your facility. Fixing, recurring issues. If you've got, an issue where, man, like the floor drain keeps coming up, well, it looks like the screws are stripped out in the bottom, right? Where we keep getting this incident reported, this maintenance tickets coming through of, the floor drain keeps coming up and people are hurting their feet on it. Well, let's fix the anchors in the floor drain, right? Fixing those sorts of issues, identifying those based on the trends of the data that we're seeing. Facility improvements, right? If you're constantly battling issues with your water stain balance, or just having enough, your pH staying within range and having enough chlorine in the pool, do you have an older facility that's grandfathered in where you've got, a longer turnover rate? Can you use that to say, man, in the last 3 years, we've seen the trend where we've had to close at least 2 hours, 4 days out of the week because our water chemistry is not able to keep up because we need a better upgraded filtration system. You can make those sorts of those arguments and those budget decisions with actual evidence to support why you're making them, not just because, oh, well, we had to close a bunch this year. It's, well, this is a multi-year issue and we can show the data to prove that. And then your operational changes, right? Like if you need to change, we've got, parents need to stay within arm's reach, and it's because we've got, most of our rescues are with kids that are under the age of 5, and we want to make sure that, we're really enforcing that rule to make some sort of operational change there. All of those things come from the data, but you've got to look at it. You've got to understand the trends and take that action to then make those improvements. And then, right, we're going to start back over. We're going to go back to the capture. We're going to understand that better. All right, we're going to continue to store that data, review it, and continue on through the documentation lifecycle there. So let's talk industry trends a little bit. And I want to preface this section of the presentation here to share that this is based off of aggregate HydroApps data. So this is off of 339 organizations across a little over 1,700 facilities. So this is almost every state in the United States, and we've got a few in Canada as well. So this is a broad data set. There's a lot of information that's collected here. And so we've tried to be really, really intentional with how we do that. So HydroApps does have CMAHC approved forms and testing values in our system set up as a default. And so we've really tried to stick with those forms so that we can really make sure that we're comparing apples to apples. And I'll touch base a little bit more as we continue on through the data set here, as we understand this and go through it. But I just wanted to make sure that you guys kind of have an understanding of where the data is coming from, what this is. There are limitations to this. Folks that are using HydroApps tend to have a stronger trend towards documenting and going through their documentation, and if you're going to digitize it, you're generally focused on making sure your documentation is where it needs to be and what's happening in your facilities is happening like it's supposed to. So there is some bias in the data, right? We're not going to get the data sets where people aren't recording things because that data doesn't exist because they haven't recorded it, right? So I think it's important to understand like the limitations in the aggregate data as a whole. Looking at some industry trends, though. So here's an example of your in-service training focus versus your incident patterns. So this is going through, we've got close to 4,000 in-services that were tracked and a little over 4,000 incidents that were tracked across these facilities. And what I think is really important to kind of take a look at here is on the right-hand side of things, we've got our incidents by type, and you can see that our incidents, our other incidents, are really high, right? It's almost double what the water rescues are at a little over 1,100 or close to 1,200 water rescues. But I want to highlight here the number of customer service training drills that are in-service skills that were conducted at those almost 4,000 in-services is 245 of those, and we had over 2,000 other incidents. And when I say other incidents, those included things like, we had to call the police. There was a fight. There was people that were upset that we had to kick out. They brought in alcohol and they weren't supposed to. So all of those sorts of things fall into the other incident category. So I like to break that down and make that digestible. Sometimes those charts they can be a little harder to see and understand. But again, right, going through that, your EAP, conditioning, water rescue, those were all practiced almost more than 6 times what the customer service topics were covered. And right, we had over 2,000 other incidents. And again, that was almost double the occurrence of the rescues, but we only practiced customer service skills 254 times. And the majority of our incidents came from, and the documentation that we made came from things that were customer service related. Obviously, as an industry, we have to focus. Our guards are professional rescuers. They need to have a good, solid working of those skills. They have to be able to perform those, right? But we are not doing enough for these sorts of incidents where when the evidence tells us that we're experiencing a lot of customer service issues, we're not practicing those nearly as often as we could be to help support them in what the operations are telling us. So this is an example of what does the evidence tell us? What does the actual data tell us is happening within our facilities, and how can we make an improvement and help adjust what we're doing in our in-service training time to support our teams to provide the best service possible, not just the CPR, first aid and rescue and skills that they need to be able to do, but also all the other general information, all the other things that they get asked to do that show up, that come through our facilities here. This is one example of that across the industry trends. Looking at incident types and ages. So this is overall incidents. So out of those, close to 4,000 incidents, if we broke it out by age range and age group. And so this includes all of those others. It should not be a surprise to see that there are a lot more incidents that include our younger folks. So right, the 0 to 4, and then that 5 to 13, 5 to 12 group. That's where nobody should be surprised to see that sort of trend in the data here. So that tracks, that's expected, that's what we would see. But again, knowing what this is like for your facility. Do you have a senior only facility, and this data is going to be wildly skewed, a different way for this? Or if you've got a large senior population that your facilities are very popular with, this data might be very skewed. What does that tell you about what you need to work on, right? What does that tell you about what's happening within your facility? Understanding who these incidents are including, and the age group, all of those things go into how do you prepare your team better to respond to those? How do you go into preventing incidents in the first place? And which opens up a whole new trend of how do we document preventative actions? And that's a whole nother soapbox that I'm not going to get up on today. But looking into, we broke those water rescues by the age group. So again, what we see here should not be a surprise. This tracks with, what we see in the CDC's drowning data of the age groups that are most at risk, for unintentional drowning deaths. And so this tracks, right? But again, what does this look like in your facility? When are these happening? Is this just general public swim? Are you seeing these? Are you seeing an increase in this during swim lessons, during swim team practice, whatever it might be? Understanding what's happening, what those age groups are, how that information informs your decisions as you go through. So looking at that 0 to 16 age group, right, as we identify this, right, 78% of our total incidents were this 0 to 16 age group. 90% of the total water rescues were included in that 0 to 16, with almost 70% from 5 to 13. That's not surprising, but it informs our decisions. What are we doing when we record these incident report, when we record these rescues? Are we communicating? Are we asking, has your child gone through some lessons? And if they say no, are we providing information about swim lessons so that they can help their child be safe in, on, and around the water, right? Those are the sorts of things, right? If you're seeing a huge spike, if your community is experiencing an issue where there's a lot of people that don't know how to swim, what are you doing to help communicate, and are you documenting that in your incident reports? Are you using every avenue you can to add preventative action in as a follow-up measure, right? So once you've helped to make sure that they don't become a drowning victim, right? But you are now also then communicating out, information on how do they help themselves prevent that, right? And not just about boosting your program enrollments or anything like that, but how are you pushing water safety in your community, utilizing the data that you have and the information that you're collecting. So all of these things, understanding the trends and seeing them and actually analyzing the data, that helps you inform how you can address those potential issues in your community or what you're experiencing at your facility in particular. So kind of shifting gears a little bit and looking at water chemistry tests out of range. Again, this doesn't feel like a surprise, right? Where we see, and again, we're looking at free chlorine and pH. These are the two most obviously, commonly tracked water chemistry metrics. And so this is one of the big focuses out of the aggregate data here is, looking at, water chemistry tests that were out of range by time. So I want to touch really quickly on how many tests were done here. And I'll share again this information. But we collected over 650,000 individual pool tests. So that's, whether they're testing every hour, every 2 hours, that's 650,000 tests that were included in this aggregate data set. And this is close to 6% of those tests, a little over 38,000 were out of range. And when we look at when that timeline spikes, we see from 9 a.m. to 4, it starts to drop off at around 5 p.m. And that's all local time based on the facility. So this is all normalized for that. But we see, right, that it spikes during the day. Not a surprise, right? You've got bodies getting in the water, you've got UV impacting. All of those things are coming through as your facility opens up. So it's not a surprise, but it helps you understand what's happening in your facility. So this is the trend, and this helps you then apply out what's happening in my facility and why, and is it different? Is it the same? And how do we adjust our operations to address any of those issues that where you potentially have a facility closure. So as we're looking at these tests, then we looked at, okay, not only are they out of range, but how are they out of range? Are they above maximum? Are they below minimum? And as we looked at pH, you can see on the right-hand side there, about 63% of the tests were below minimum values, and these were tested against MAHC standards. And so all of these, right, were about 63% of these were below. As we looked at the general data as a whole, pH, when it was out of range, was fluttered, between that 60% and 65% mark of the minimum. So, 2/3 of pH tests were generally below minimum requirements. For the chlorine, when we were looking at MAHC, almost all of them, so far and away the majority, almost 95%, were below the minimum range. And again, that informs that provides you a huge data point, right? Knowing this allows you to ask questions. Is this related to bather load? Is this swim team practice that then, right, we've got a ton of kids hop in the water, none of them took showers ahead of time, and we've got a ton of, just organic matter that's jumping in and eating up our chlorine. And then that helps inform your decision then, is this UV related only? Are we using stabilizer to help adjust this? Are we using too much stabilizer? What do these testing requirements look at? Is this something that is our facility, chlorine feeder system just can't keep up when we have, just a normal bather load, not even close to our maximum bather load in the system? How does this inform what you're looking at, to evaluate your water circulation system, looking at your chemical feed system? This helps you ask those questions to understand what's happening in your facility. What does the data mean? What does it actually tell you? Not just was it out of range, was it below the minimum, above the maximum? So understanding, taking the deep dive into it, setting your data up to be able to tell you this kind of information is huge, right? So that you don't have to do this every single time. When you set up how you're collecting your data and how you're storing it, set these sorts of things up ahead of time so that it's really easy for you to make decisions in real time off of the data that you're collecting. So while this is what we see across the industry, this may be different at your facility, and that's going to inform your decision about what matters. right? So talk, really briefly, but kind of want to go through this in Word format for those that digest this a little bit better that way, right? But most of the out of range for pH and free chlorine tests occurred between 9 and 4 p.m. 95% of those were below that minimum. 63, almost 2/3 of pH tests were below minimum there. So what are some common gaps that come through that? Missed or delayed tests, inconsistent incident classification, lack of follow-up documentation, overuse of other categories. So that's a big one that we see. And I know I highlighted that we had a lot of other. We normalized a lot of the others to make sure that we weren't collecting. But we also saw, so I pulled first aid related others into first aid to make sure that what was getting reported, was in the accurate category. But we see a lot of folks include a lot of first aid or random things in other. The more consistent categories we can use, the more we utilize industry standards out of the MAC to help us guide and understand these sorts of incidents in our facility, the better off we are, the better we're able to benchmark. So, not just lumping everything into another category, right? Like actually, like EMS was called, police were called, it was a guest disturbance. Anything that we can do to highlight industry standard terms is going to make a better use of your data and help you understand that data better. And when you're looking at this data on an individual basis at your facilities, making sure that your team is using consistent language in that as well. So I'll say that's something that can be really common in where your team is just writing out the type of incident versus having a drop down in a digital tool, or having a selection digital tool versus a paper where they can circle an incident type. So training them to use consistent documentation, consistent language, that is going to help, those incident reports tremendously. Same thing on your missed or delayed test, right? Accurately reporting that time. And if it's delayed, why was it delayed? So reporting on why it was delayed, so you have a good understanding. Do you not have enough people there? Are you asking too much of your head guards that are running your front desk? Are they having to do all the cashier duties, all the opening duties, and you're expecting them to go take, a pool test and then take a test right out of the controller as well? Are you expecting them to do all of that at the same time? Is that why it's getting delayed? How identifying those sorts of things, understanding the gaps in your documentation, and then updating it to collect that additional data point to help you understand what's happening is huge. And then finally, again, I told you I was going to hammer this home. Your linkage between your data and your decisions is huge. That's a huge common gap where people are waiting until after the end of the season to look at it because it's on paper. They haven't plugged it into a spreadsheet. You do your team and you do your facilities a disservice by not taking a look at it in real time to help them get better, right? If you're using, if you've got a really robust audit program where you're, auditing your guard skills all the time, are you sharing that information, to them directly to show what sort of improvement are they making? Are you sharing that to the supervisors that are responsible for coming up with the in-service plan, or are you just following a standard plan? Right? Are you highlighting, hey, your guards are struggling in the audits on this particular portion of a CPR skill? So it would be helpful if you guys focus on that as a whole. And then you're also seeing a lot of rescues in this area. So you might want to go through a scanning drill in this zone as well. Using that linkage between your data to drive those decisions, improve your team performance is going to make a huge, huge difference. So again, I'll continue to drive this home because it is such a common gap that we hear about. And right, as a new supervisor, I was guilty of that. I didn't look at it like my first couple of years. I was looking at everything at the end of the season because I was just trying to make it, right? I was trying to keep my head above water. But the more that you can do to set things up ahead of time, it's, we're a day shy of April 1st. You've got time to at least do this for one before you get to the summer season. So as you highlight that, as you go through, just understand some of the common gaps in how this plays out. So what are high performing facilities doing? What are they doing differently? They're standardized. They're standardizing their form. They've got standardized processes. They've got a regular review, a consistent review cadence. They're using dashboards. They're using ways to make that data visible to their team. Even if they're collecting information on paper, so they're plugging into a spreadsheet, they're printing that out. They're finding a way to communicate that out to their team to make sure they have as real time of information as they can get in order to support their operations on a daily basis. And then they're using that documentation to hold their team accountable. Right. I don't know if you heard Dewey and I at the beginning, but when we're talking about when you hold your team accountable, your low performers filter out, your high performance know that they're being supported. They're not having to pull away for everybody else, but it keeps your facility operators accountable. It keeps you accountable as a supervisor operating these facilities and supporting your team. It's a huge, huge way to hold teams accountable, is having clear, consistent documentation, communicating it out for them, and it's going to make your operations better as a whole, bar none. Let's talk about building your framework. So super simple framework here as you look at your documentation. When you're understanding, as you get into that documentation lifecycle, build your framework here to understand how you're going to make those improvements, and how you're going to analyze and understand that. So let's define what matters. What data is actually driving your decisions? What do your stakeholders need, right? What does their city council or board of directors or whoever you've got to report to? What does your supervisor need to get? What information is important? And then what are you going to have to do to stay compliant, right? That's a must. We know that. What do you need to be collecting to drive better decisions for your operation? What are you already collecting? What is extraneous information that's not needed to do that? And that kind of drives you then to the next step here in the framework process is simplify the collection, right? Remove those unnecessary fields, or as you get into potentially even looking at using a digital tool, you might want to collect a bunch of information, but if you have it set up to where questions only show up when you answer a certain one, say like, hey, we want to collect what sort of water rescue was this an active victim, a guest at the service, a passive guest, a submerged victim, a spinal victim. You don't need to collect that on every single report because maybe this is just a first aid report, but you can simplify it so it only shows up when you select that water rescue as the initial incident type. So then you've made it, again, really simple for your team to collect the information and remove those unnecessary fields. You don't have a huge report that's blanked out because it didn't matter. So the more simple you make it for your team to use, the better your data is going to be. And then create your cadence review. What are you going to be reviewing daily? What are you going to be reviewing weekly? What are you going to be reviewing monthly or annually? Go through that, set that review. If daily means every other day for you right now, or every 3 days, or every Monday, Wednesday, Friday, whatever that looks like for your operation, understand, set that review process ahead of time, make it easy for yourself. You know what your limitations are. You know what's happening in your operation. We all wear a million hats as aquatics facility operators. We get pulled in a million directions. So set this review process to be something that's attainable for you, especially if this is something that you're starting from scratch. And then establish ownership. Who's going to be reviewing what? When are they going to be reviewing it? Is this just you? Are you the only one doing it? Or do you have help? Is this something that you can delegate? Establish that ownership for the review process, and then close that loop. What actions from the data are coming? And then build that into the documentation lifecycle. As you go through, you've updated, you're capturing, you're storing, you're reviewing, you're analyzing. As you continue to go through that whole process, right? Understand when you get to that act phase, this is where you're at. When you're making your decisions on how you act, go through this framework process again, right? Define, am I collecting what I need to collect based on the data that we analyzed? Is it simple, right? Review, is the review cadence working? Am I able to make decisions as soon as I want to? Was there a challenge in who was responsible for those review periods? And again, close that loop. So this is going to fall within that, between that analyze and act, as you put out and then as you move into your capture phase of the documentation lifecycle. So really simple framework process, makes it really easy, but utilize this as we go through, as you go through and reviewing and building your framework out for the season. So let's talk your implementation roadmap. How do you get started, right? Assess again, right? What are you currently collecting? Clean up, standardize, simplify it, activate this. Start your regular reviews, optimize, use those insights for decision making. My big advice here too for you is start simple, start small. Go into one, right? Pick one thing that you can do this with, one piece of documentation. We've got a million things happening. Make it easy on yourself. But start this process by assess, clean up, activate, optimize. Super straightforward. And we're going to share this with you guys as well. So you will have this presentation sent out to you, as a part of this webinar here. Let's talk tools and kind of tech considerations. So your paper versus digital. If you don't have the support for a digital tool, granted, I'm a little biased, I understand that, but digital tool provides so much more real-time visibility, options for automation, alerts, and flags. If you don't have that option, set up your process for how your paper is going to get into a place where you can analyze it. That means, right, using today's tools that are available, you're plugging that into a spreadsheet somewhere. Again, define who's going to be responsible for entering, who's going to own where that, when that paper is getting brought in, who's going to enter it in the spreadsheet, how soon does that need to be completed, and then then you can start to get into your real-time visibility, into your automation, your alerts, your flags that are sharing that with you. And again, maybe your automation is the process that you set up for your team to notify you. Do you have a process where if your pool tests are out of range, they need to notify a supervisor on duty, whether that's you or somebody else? Are they letting you know that something's not right within your facility so that you can help guide them on what the next step should be? Think about what your reporting capabilities need to be. You understand now, right, what your goal is for you to understand what information you want to be getting out of your data so that you can start to make better decisions. Think about how your reporting capabilities are set up for that. Does this tool, if you're just using paper and Excel, what do you need to have set up to be able to get the information that you need? If you're using a digital tool, are there limitations based that you need specific pieces of data for your organization or your local health department require something a certain way? Can that digital tool function that way? Are they flexible enough to go through? So one of the big things that we talk at HydroApps is how do we be as flexible as possible, because we know there's so many different local authorities that influence how you collect your data so that you can stay compliant. Do you have a tool that is going to allow you to stay flexible in your reporting capabilities for what you need? And then you don't know what you don't know. This is hugely important for new supervisors and even seasoned facility operators that haven't taken a look at MAC or CMAHC standards. I know I'm preaching to the choir with the audience that we've got today, but you don't know what you don't know. And so utilizing tools that can help you understand your operations from top to bottom. Do you have a compliance tool? There's a lot of third parties that have them. I'll say maybe not a lot, but I know HydroApps has one where you can go through and analyze from top to bottom against industry standards, against Model Aquatic Health Code standards, looking at your information, reviewing to make sure that your operations from top to bottom meet industry standards. If that's not an option for you, review your documentation, pull your state codes, pull the MAC, look at it, and make sure that it's compatible. You don't know what you don't know. And so if you're not constantly reviewing what the current state of your local health code requirements, your state requirements are, be reviewing that information constantly to make sure that your operation is collecting the minimum. Obviously, we do have to stay compliant, but then add on to that what you need, for the information that you want to collect as you go through the documentation lifecycle there. So looking at some of the key takeaways, right? Documentation is only valuable if it drives action for you. The lifecycle approach is going to give you some structure and it'll give you a process to go through. Small changes are going to provide a huge, huge improvement for you. Right? Your data can and should guide your daily operations. Again, like I mentioned earlier, right? Get started now. Pick one gap in your current documentation process, implement one review practice this week, and start using your data to answer one operational question. Your data is a treasure trove of information that will help you improve your operations, improve your service, improve your programs. Right, we didn't even hardly touch on programs. We talked water chemistry and we talked your lifeguard skills and audits, right? Those were the initial highlights, but the amount of data that you are actually sitting on is likely very, very significant. Pick one thing that you wish you were able to use to make decisions better. Start that process now. Fold that in as you go along. The summer is not the time to add this. Now is the time. If you're not doing any of this, now is the time to add it. This is where you've still got time to train your supervisors. You've still got time to get everything ready for the summer. Pick one thing so you don't feel overwhelmed. And as you go through the process and you get better at it, start wrapping in your other pieces of documentation. But again, what I say is get started now, pick one thing this week and start to put this into practice. And that's what I've got. So thank you. I appreciate you guys listening to my spiel. But this is a point where now we can ask questions. So if we want to open this up and you guys want to jump in. If you want to put it in the chat, that's great. I've got the chat pulled up, but I'm also, if we want to go ahead and let you guys jump in with video and audio, happy to answer questions.
Marty, I just want to give props to you on the data collection. I was listening very intently on the pH and free available chlorine numbers. That's impressive data. Um,
Thank
it,
you.
it reminds me of the study CDC did back around 2016 or so that keeps catching, right? Because it showed similar data, but your data set's much, much larger. So,
We tried to, and this is as the industry is shifting towards using digital tools, right?
yeah,
Just like they made the shift from manual chemical adjustments using automated controllers, that we're shifting towards the digital documentation of what's happening in your facilities. That makes it easier to analyze this data as on the whole, and it helps us make better decisions. It's going to help us make better policy decisions in the future, influence what goes into the MAC, and that's what we're here to do, right? Is help understand this information and help you guys benchmark against what's actually happening in facilities and not just what should be happening in facilities. So
yeah,
appreciate the shout out there.
yeah, very good stuff.
What other questions do folks have?
Quiet bunch,
Insights?
Marty.
It is a quiet bunch. A
Yeah.
quiet bunch. Any folks that are hearing from health departments that want to understand, how they could, how this fits into what their operations look like, and what that means is they go out and they inspect, public facilities, because that's something we've looked at too, right? Is how do we make it easy for operators to share it with their local health departments, their local authorities, that are supervising or have jurisdiction over their operations.
Yeah, just kind of kicking in on that. One thing, because we've been advocates of digital documentation for quite a while now in our public health sphere and circle of influences. The big thing we just keep hearing from our health officials is that not that digital documentation is bad, right? The big thing is they need access when they walk in the door. So that's kind of the only real thing is just making sure that that access is available, when the inspector's there.
Yeah, I think that makes perfect sense, and that's
Yeah,
those are things that are easy for an individual tool to be able to set up. To whether that is a limited permission account, or whether that is just a user logging in with the right permissions to be able to view
yeah,
that. There's lots of ways to address that need. And so there's not a digital tool out there that doesn't recognize that the easier we make it for health inspectors, the easier we make it for operators to view and see their data, the better off it's going to be. And we're a huge proponent of that as well. So,
yeah, absolutely.
anybody have any thoughts, any insights? All right, well, then I will leave you. I actually want to leave you with one more story out of this. So this is a personal story, and I'm going to come back to the rescue reports here and talk about where they were happening. So as you talk about, we didn't even go through anything on, the zones, the depth of water, there are some gaps in kind of the aggregate data in terms of what the depths of the zones are. But as you look at your incidents, one of the personal experiences I've had with utilizing this sort of information is we had an area at my last stop. We had 14 pools, and it was a lily pad area of the facility, and it was the single highest water rescue incident rate of any zone across 14 pools, and that included like our large water park facility. And so in what we did, we said, okay, why is that an issue? What is happening there? We started looking at the age range of the incidents that were occurring. And we realized that that's mostly been we were looking at 5 to 8 that were coming through there. And then we went and looked, and we actually sat out, we watched like what is happening, what's going on. And what we realized is that the depth of the water was 4.5 feet, so it's 54 inches, and the height requirement was 48 inches. And right, that's the manufacturer's height requirement, or recommended height requirement to utilize it. And what we realized is that kids were falling off, and then they met the high requirement, but they were then falling off and slipping, and they were 6 inches below the surface of the water. And so they were really struggling to get back up to the surface, to even grab hold of the lily pad or the edge of the pool, right? And we realized that was the impetus. That was what we were seeing, is that we had kids that were essentially too short in that area. So we made the decision in the season to change the height requirement to 54 inches. So we matched the depth of the water. We communicated out to our community on what was going to happen, why we were making that change. And then, right, we monitored, we did surveys, and we did a good job of understanding the impact that this change had also made. Do we have a few complaints? Yes, but far and away the majority were really, really positive, because obviously no parent wants to see a lifeguard go in after their child. That's a terrifying feeling, right? And so we had a ton of positive feedback, and we saw the incident rate drop dramatically, to where it was in line with any other zone in our area. But those are the sorts of operational changes that make sense, right? That you can utilize your data to make a change in the middle of your season, to impact and make your facility safer, make your operations better. So I want to highlight that again here before we got too close to the end here. So I'll leave everybody with that. Again, just another example of how do you utilize the data to improve your operations. So that's what it's about.
No, that's great. That's great stuff. Marty, thank you so much for your time today. Thank you so much for the attendees for being here today. Marty, just as a side note, I'm going to connect you with someone that may be interested in hearing about this data. So
Absolutely.
just look for that email separately, okay?
100%. Be glad to do it.
Yeah. Well, everybody, thank y'all very much. I hope y'all have a wonderful spring startup season. Marty and I were talking earlier about how just it seems crazier this year for some reason. So be safe, stay safe. Remember, everybody walks out their own 2 feet. We can solve every other problem. So, Marty, thank you. Thank you, everybody else, for being here.
Thank y'all. Appreciate it.